Imagine sitting in a medieval marketplace, watching a barber shave a customer's beard, then immediately turn to perform delicate eye surgery on his next client. No hand washing, no sterile instruments, no medical degree, just the same razor he used for shaving, a collection of herbs for pain relief, and years of experience learned through trial and error. This wasn't unusual in medieval Europe, where barbers routinely performed surgery, dentistry, and medical procedures that would require decades of specialized training today. How did they do it? How did medieval barber surgeons achieve surgical success rates that often exceeded those of university-trained physicians, despite having no formal medical education and working with primitive tools? The answer lies in a unique combination of practical experience, guild knowledge, and surgical innovation that developed outside the formal medical establishment. While physicians studied ancient texts and debated theoretical principles, barber surgeons learned by doing, developing hands-on techniques that were often more effective than academic medicine. They created a parallel healthcare system that served common people who couldn't afford university-trained doctors, proving that surgical skill could be acquired through apprenticeship and practice rather than formal education. Medieval barber surgery emerged from the practical reality that people needed medical care but couldn't access or afford university-trained physicians. Barbers already possessed sharp tools, steady hands, and experience working close to human bodies. The transition from cutting hair to cutting into bodies was a natural evolution that filled a critical healthcare gap in medieval society. Barbers began offering simple procedures like tooth extraction, wound treatment, and abscess drainage, gradually expanding their services as their skills and confidence grew. The guild system that controlled barber surgery created standardized training programs that ensured competent practitioners while protecting the profession from unqualified competitors. Apprentice barber surgeons learned through years of hands-on training under master practitioners who taught not just surgical techniques, but also business skills, professional ethics, and customer relations that were essential for successful practice. Guild regulations established quality standards, pricing structures, and professional conduct rules that maintained public confidence in barber surgical services. But here's where medieval barber surgery becomes truly remarkable. These practitioners developed sophisticated surgical techniques that often surpassed the effectiveness of university medicine. They understood anatomy through direct observation rather than ancient texts, learned wound healing through practical experience rather than theoretical study, and developed pain management techniques through trial and error with real patients rather than academic speculation. The most crucial barber surgical skill involved speed and precision that minimized patient suffering and reduced infection risk. Master barber surgeons could extract teeth, remove cataracts, or amputate limbs in minutes rather than hours. Understanding that surgical success often depended on completing procedures before patients went into shock or blood loss became fatal, they developed specialized techniques for each type of operation, creating standardized procedures that apprentices memorized and practiced until they achieved automatic proficiency. Pain management represented one of the greatest challenges facing medieval barber surgeons, who needed to keep patients conscious and cooperative during procedures while minimizing suffering and trauma. They developed sophisticated herbal anesthesia using combinations of opium, mandrake, and alcohol that provided effective pain relief without completely incapacitating patients. Some practitioners used compression techniques that temporarily numbed specific body areas, while others employed distraction methods that redirected patient attention during critical surgical moments. The herbal arsenal available to skilled barber surgeons was surprisingly extensive and effective. Willow bark provided natural aspirin for pain and fever reduction. Poppy extracts offered powerful pain relief for major procedures. Comfrey and calendula promoted wound healing and reduced infection risk. Garlic and honey possessed natural antibiotic properties that prevented post-surgical complications. Master practitioners guarded their herbal recipes jealously, passing down combinations and preparation techniques that had been refined through generations of use. Barber surgeons developed ingenious sterilization techniques that reduced infection rates, despite having no understanding of germ theory. They understood empirically that clean instruments and fresh bandages improved patient outcomes, leading them to develop cleaning protocols that were remarkably effective. Some heated their instruments in flames before use. Others washed tools in wine or vinegar solutions that possessed natural antiseptic properties. The most successful practitioners insisted on clean working environments and fresh materials for each patient. The economic model of barber surgery made medical care accessible to ordinary people who couldn't afford university-trained physicians. Barber surgeons charged reasonable fees for basic procedures, offered payment plans for expensive operations, and sometimes accepted goods or services instead of money. They operated small neighborhood practices that served local communities, creating personal relationships with customers that encouraged early treatment of medical problems before they became serious. Urban barber surgeons developed specialized practices that catered to specific customer needs and medical conditions. Some focused on dental work, becoming expert tooth extractors who could remove damaged teeth quickly and painlessly. Others specialized in eye surgery, developing techniques for cataract removal and other vision problems that were common in medieval populations. Military barber surgeons became battlefield specialists who could treat arrow wounds, sword cuts, and battle injuries with remarkable efficiency. The tools of medieval barber surgery were surprisingly sophisticated, representing centuries of technological development and practical refinement. Surgical knives were crafted from the finest steel and maintained to razor sharpness. Forceps and clamps were designed for specific procedures and body parts. Cauterizing irons could seal wounds and stop bleeding when other methods failed. Trepanning tools allowed skull surgery for head injuries and mental illness treatment. Master barber surgeons often crafted their own instruments, developing specialized tools that gave them competitive advantages in difficult procedures. They understood metallurgy, tool maintenance, and equipment design in ways that enhanced their surgical effectiveness. Some practitioners developed signature instruments that became famous throughout their regions, attracting customers who sought the benefits of superior surgical tools. The relationship between barber surgeons and university-trained physicians created ongoing tension that shaped medieval medical practice in complex ways. Physicians viewed barber surgeons as uneducated craftsmen who threatened professional medical standards. Barber surgeons resented physician claims to superior knowledge when practical results often favored surgical intervention over theoretical treatments. These professional conflicts led to legal battles, guild disputes, and regulatory challenges that continued for centuries. Despite professional tensions, practical cooperation often developed between physicians and barber surgeons when patient care required combined expertise. Physicians would diagnose conditions and prescribe treatments, then refer patients to barber surgeons for surgical procedures they weren't trained to perform. Barber surgeons would consult physicians about complex cases that required theoretical knowledge they didn't possess. These working relationships created informal medical teams that provided more comprehensive care than either profession could offer independently. The training system for barber surgeons created a unique educational model that combined practical apprenticeship with professional development in ways that were remarkably effective. Apprentices began with simple tasks like tool maintenance and patient preparation, gradually progressing to assist with minor procedures before attempting major surgeries under master supervision. This hands-on learning approach produced practitioners who understood both technical skills and patient psychology necessary for successful surgical practice. Master barber surgeons developed teaching techniques that emphasized practical competence over theoretical knowledge. They used anatomical models, practiced cadavers, and detailed demonstrations to teach surgical procedures. They created apprenticeship programs that included business training, customer relations, and professional ethics alongside technical skills. The most successful masters produced multiple skilled practitioners who carried forward refined techniques and expanded the profession's capabilities. The geographical reach of barber surgical services created healthcare networks that served rural and urban populations across medieval Europe. Traveling barber surgeons brought surgical services to remote areas where permanent practitioners couldn't maintain viable businesses. They coordinated with local healers, midwives, and religious institutions to provide comprehensive medical care in underserved regions. These itinerant practitioners often specialized in procedures that required advanced skills, but weren't needed frequently enough to support full-time local practice. Market towns became centers of barber surgical activity during fair days and religious festivals, when large crowds gathered and medical emergencies were more common. Temporary surgical clinics operated alongside other commercial activities, providing emergency treatment for accident victims and routine procedures for people who couldn't access regular medical care. These seasonal practices required portable equipment, rapid patient turnover, and adaptability to varying working conditions. The military applications of barber surgical skills made these practitioners essential participants in medieval warfare. Army barber-surgeons treated battle wounds, performed emergency amputations, and provided battlefield medical care that could mean the difference between victory and defeat. They developed specialized techniques for treating arrow wounds, sword cuts, and crushing injuries that were common in medieval combat. Military service provided barber-surgeons with extensive trauma experience that enhanced their civilian practice skills. Siege warfare created particularly challenging conditions for barber-surgical practice, requiring treatment of infected wounds, malnutrition-related illnesses, and epidemic diseases under resource-constrained conditions. Military barber-surgeons learned to work with limited supplies, improvised tools, and minimal facilities, while maintaining treatment effectiveness. These extreme conditions fostered innovation and adaptability that benefited civilian medical practice when practitioners returned to peacetime careers. The social status of barber-surgeons reflected their unique position as skilled craftsmen who performed essential services while remaining outside the formal medical establishment. They enjoyed higher social status than ordinary tradesmen, but less prestige than university-trained physicians. Their income levels often exceeded those of other craftsmen, and successful practitioners could achieve substantial wealth and community influence. However, their lack of formal education and association with manual labor limited their acceptance in elite social circles. Professional barber-surgeons developed sophisticated business practices that maximized their income while maintaining customer satisfaction and professional reputation. They offered service packages that combined routine procedures with emergency availability. They established referral networks with other healthcare providers and maintained relationships with institutions like monasteries and hospitals. The most successful practitioners expanded into related areas like pharmacy, medical supply, and healthcare consulting. The decline of barber surgery resulted from changing medical education standards, professional licensing requirements, and the rise of hospital-based surgical training that separated surgery from barbering. Universities began offering surgical training that combined theoretical knowledge with practical skills, creating formally educated surgeons who claimed superior qualifications. Professional medical organizations restricted surgical practice to licensed physicians and gradually excluded barber surgeons from medical practice. However, the practical innovations developed by medieval barber surgeons established foundations for modern surgical technique that continue to influence contemporary medical practice. Their emphasis on speed, precision, and patient comfort became central principles of surgical care. Their development of specialized instruments and procedures created templates for modern surgical innovation. Their focus on practical results over theoretical knowledge established empirical approaches that remain essential to medical advancement. Medieval barber surgical training methods influenced modern medical education through their emphasis on hands-on learning, graduated responsibility, and master-apprentice relationships. Contemporary surgical residency programs follow patterns established by medieval guild training systems. The integration of technical skills with patient relations and professional ethics that characterized barber surgical education remains central to modern medical training. Most importantly, medieval barber surgeons demonstrated that effective healthcare can be delivered by skilled practitioners working outside formal academic institutions when they possess adequate training, appropriate tools, and commitment to patient welfare. They proved that surgical competence can be acquired through practical experience and guild training rather than university education, challenging assumptions about professional qualifications that persist in modern healthcare debates. So what tricks did medieval barber surgeons use to perform surgery without killing patients? They developed sophisticated techniques based on practical experience, guild knowledge, and patient observation, rather than theoretical study. They created sterilization procedures that reduced infection risk, pain management methods that minimized patient suffering, and surgical innovations that often exceeded the effectiveness of university medicine. They understood that surgical success depended on technical skill, psychological insight, and practical wisdom that could only be acquired through years of hands-on practice with real patients facing genuine medical emergencies. They created healthcare delivery systems that made medical care accessible to ordinary people, while maintaining professional standards that protected patient safety and practitioner reputation. The next time you visit a modern hospital or appreciate the sophistication of contemporary surgical care, remember the medieval barber who set down his razor, picked up his surgical knife, and performed life-saving operations with nothing but skill, courage, and accumulated wisdom passed down through generations of guild masters, who understood that healing required both sharp tools and steady hands. If you enjoy the hidden sides of medieval life, hit subscribe and give this video a like.